Hi, everyone. It's Wendy with Cole in the Community. Today, I am so excited to present Dr. Michelle Suhendra to you. She is an amazing pediatric doctor here in our community, and we just really want to highlight her and just kind of showcase everything that she's doing as far as pediatrics. So thank you for joining us today.
Thanks for having me.
Thanks. So do you want to give us a little bit of your background, how you got involved in medicine, and
Yep.
why you do what you do?
So I'm a native Houstonian. I was born and raised here. Went to California, went to Stanford University. I actually got my degree in engineering. And I am a homegirl, so I like to come back home for the summers. So I did a lot of internships actually in oil and gas. So when I graduated from college, worked for an oil and gas company for a couple of years and decided that that wasn't quite the right fit for me. So went to med school up in Dallas. I married my husband in med school, and then we had a baby, my third year of medical school. So that shaped a lot of my choices and decisions. Having a child really kind of reframed how I thought about medicine, especially kind of being on the other side of the table. So decided to go into a pediatrics residency, came back to Houston, which was fantastic because my family was here. Um, so I did a pediatric residency, loved it, loved my job. I joined a really great group in the medical center in Houston, worked there for many years, for a little over 7 years, and then decided to start up my own practice in the middle of the pandemic up here in the Woodlands. Yeah.
Very nice. And what was that like for you? And what made you choose the Woodlands? And you're in a beautiful office. For those of you that haven't been over to the Moon Pediatrics, she has a beautiful, gorgeous office there at the Methodist Woodlands campus. And it's just phenomenal. And her rooms are great, very child friendly. Love your office. It's so fun and clean and safe and all that fun stuff. Do you want to kind of share why you chose to move to the Woodlands?
Yes. Well, we actually moved up to the Woodlands. My husband and I both were close to the med center, and then we moved up to the Woodlands for his job. So I was making the commute, and we have three kids, and it was just, work-life balance wasn't balancing out so well. So it was a big jump, and especially to make a lot of decisions. We made a lot of decisions before the pandemic, and when the pandemic hit, we were like, "Ooh, is this the right thing to do?" But we had faith, and we, full steam ahead. My husband actually helped me design the layout of the office. We were really wanting it to be family friendly, big spaces, room for double strollers, um, fun decorations in the rooms without it being too cheesy. So yeah, it was a lot of big decisions, but I would do it all over again.
It's a very beautiful office. If you guys haven't visited her, you should. And what are some things that that you had to adjust to in COVID with your practice? What different services do you offer now because of COVID, or what do you do in the office?
So when I opened up this practice about 4 months ago, so November 2nd was when I was over here. So we'd already been in the pandemic for a little bit, for several months at that point. And so I knew that telemedicine was going to be a big part of my practice. I've been very blessed to have very kind patients follow me from my practice in the medical center. And so for patients who live far away, telemedicine has actually been really great for things like rashes and constipation and behavioral stuff, ADHD checks and stuff like that. Actually doing telemedicine where I can kind of see these kids in their kind of home environment has been really nice. And I think it's also been really convenient for the parents. You're not having to haul the one kid who's the patient, but also any other children you might have, and then everyone has to get screened. Everyone get your masks on. So telemedicine has been huge. And then, one thing that I found in the pandemic at the beginning anyways, was that there was a lot of fear of going into the office.
Mhm.
What I love about our office is it's a really small, we're like I like to think we're kind of a boutique office. It's just me. I'm the only physician here. I've got two really great staff members, Patty and Heather, who are really personable. But, because we're a small practice, I don't have tons of kids waiting in the waiting room. And so we have a big waiting room because before, when we designed the place, I was like, we have to have space for everyone to be there. The pandemic hit, I was like, we're not really using the space. We're just going to shuffle them straight from when they check in to come back to the exam room. So it's been helpful to be able to see patients without having to worry about a bunch of exposures in the waiting room or people having to wait a long time. So it's been really great.
That's really nice. And it is, I've been there with my own child in your office, and it's very accommodating for children. So we appreciate that. What are some tips or resources that you would like to tell parents about or share with us?
So I always try to educate my patients on, like, especially when their kids are sick, on like what things to watch for. Here are things that are okay. Here are things that are not okay that you should call me for. There is so the American Academy of Pediatrics has healthychildren.org, which is a really great evidence-based medicine, lots of good information on there. Unfortunately, there's a lot of misinformation on the web, and it's hard to sometimes tease those apart from things that are good and reputable. But healthychildren.org is something that I refer my patients to a lot. On my website, on overthemoonpeds.com, I have a symptom checker. So that's also backed by Dr. Schmidt, who is in lots of good evidence-based medicine for pediatrics. So like, if it's 11 o'clock at night and you notice that your kid has a rash, I try to tell people, I don't know how many people have actually used it yet, but to go to my website and click on the symptom checker and say, okay, I've got a 11-month-old with a rash and it's a girl and here's where the rash is. And they'll kind of walk you through what are things to look for, what are things that you can try, and here's when to schedule a doctor's appointment. Here's when it's like emergent, but I like to get to know my families. And so I always want to have an open line of communication with my patients and their families. And so I always tell people there's no stupid questions in pediatrics. Like, I would rather you ask me and me tell you the right way to do things or what I would recommend versus you like not being sure about something and do something that could be potentially harmful or, something like that. So I really just try to direct people to good sources of information.
I really like that. And we'll make sure to include both of those links down below for y'all. And super great following those evidence-based practices. We love hearing those words. So, so quit Googling and just go to her website and check
There you go.
healthykids.org. So, but thank you so much for joining us, and thank you for doing what you're doing and making a difference in our community. It was so great seeing you.
Same. Thank you so much, Wendy.
All right. Bye.
Bye.